Today, we're diving into a fascinating diagnostic journey. We're going to be solving the puzzle of a really complex genetic condition known as Prader-Willi syndrome. So get this, it's a real head-scratcher. You have a baby who just doesn't want to eat. They have trouble feeding, they're not gaining weight, but then a few years later, that very same child develops this insatiable hunger, like they're never ever full. So what's going on here? This paradox is the central mystery we're going to piece together today. Okay, so this puzzle actually has a name, Prader-Willi syndrome, or PWS for short. And figuring it out isn't just a guessing game, it's a really careful investigation. So we're going to walk through exactly how doctors connect the dots, from those very first suspicions all the way to a definitive answer.
You know, every good investigation starts with gathering clues. And for doctors, that means looking for a very specific pattern of signs and symptoms, all laid out on a diagnostic checklist.
Now, this isn't random at all. There's actually a formal scoring system. Doctors look for a certain number of major criteria, those are the really big, significant signs, and minor criteria, which are more like supporting clues. If a person's symptoms add up to a certain score, that's a huge signal that genetic testing is the logical next step. All right, let's look at the clues themselves. On the left, in that major criteria column, you can see the big signals. We've got weak torso muscles in babies, and of course that classic switch from having trouble sucking to that constant hunger. Then over on the right, you have the minor clues, but they're still really important. Things like skin picking or sleep problems. You see, individually, any one of these might not seem like a big deal, but when you put them all together, they start to form a really distinct pattern that points doctors in a very specific direction. So once enough clues have been gathered, it's time to go from just being suspicious to being certain. And for that, every investigator needs a master key. In this case, that key is genetic testing. And this is a really crucial point. All those physical signs and symptoms on the checklist, they are absolutely vital for raising the alarm. But they can't make the final call. Only a genetic test can unlock a conclusive, definitive diagnosis.
And this is the test that does it. It's called the DNA methylation test. The easiest way to think about methylation is like a system of on and off switches for our genes. This blood test looks at those switch patterns on a specific chromosome, chromosome 15, to see if they're working correctly. It's considered the absolute gold standard because it can spot the exact incorrect pattern that signals PWS.
So, just how good is it? It's over 99% accurate. I mean, that level of certainty is exactly what families and doctors need. It just removes all the doubt and really provides a clear path forward. This right here shows exactly why this specific test is the master key. Imagine you think there's a problem with a house. The DNA methylation test is like doing a full inspection of the entire foundation. It can tell you if there's a problem no matter where it is. Other tests, like FISH or a microarray, are more like only checking the windows or maybe just the plumbing. They can be useful for figuring out the type of problem, but they might miss the issue in the foundation entirely. And that's why a negative result from those other tests doesn't close the case. The methylation test is absolutely the crucial first genetic step.
So the methylation test confirms if a person has PWS. The next natural question is, how? It turns out there are 3 different genetic paths that all lead to the exact same syndrome.
As you can see here, there are 3 main causes. The most common one, making up about 60% of cases, is called paternal deletion. And that just means a tiny piece of the father's chromosome 15 is missing. The next one, at around 35%, is maternal UPD. That stands for uniparental disomy. This is what happens when a child gets both copies of chromosome 15 from their mother and none from their father. And finally, a very small percentage have what's called an imprinting defect, which is basically a problem with those genetic on-off switches we talked about earlier. The really important thing to know is that these are almost always just random genetic events, not something that's typically passed down through a family. You know, part of what makes PWS so tricky to diagnose is that the clues change over time. The syndrome looks very, very different at different stages of a person's life. This timeline really puts it all into perspective. During infancy, the big worries are low muscle tone and serious feeding issues. A baby might even get a failure to thrive diagnosis. But then, fast forward to early childhood, and the script completely flips. All of a sudden, it's about that insatiable hunger, along with developmental and behavioral challenges. And as they get older, those issues often continue, and delayed puberty becomes another key sign. You can see how this evolution of symptoms is exactly why a diagnosis can sometimes be missed early on. So, the puzzle is solved. A diagnosis is confirmed. What happens now?
Well, understanding the diagnosis is just step one. The next chapter is all about taking action.
If you have concerns, the steps are pretty clear. First, talk to a healthcare provider about the specific signs that you're seeing. And don't be afraid to ask directly about genetic testing for PWS. If a diagnosis is made, the conversation needs to immediately shift to early treatment options and building a solid care team. And finally, connecting with support organizations is huge. It can provide an absolutely invaluable community and resources for families who are navigating this journey.
So we'll leave you with this thought. After going on this entire diagnostic journey, from a totally baffling symptom all the way to a clear genetic answer, what's really the most important first step? It's simply noticing that first clue and then asking the right questions.